Thank you, Mr. Chair, and thank you to all the presenters. Some very good discussion here today, and I'm certainly learning a few things. I represent the Northwest Territories, and regarding freight costs, I wanted to say we run our alcohol distribution through a liquor commission in Northwest Territories, and the cannabis is going to be run through the same commission. And we already have a lot of controversy over subsidizing the price of alcohol. When we have alcohol landing in a far north community and it's cheaper than what it is in the south, we have a lot of people raising eyebrows. And I think we're going to have the same problem when it comes to cannabis. But I don't have the same concern when it comes to medical marijuana, because I know the benefits of the use of medical marijuana. I got a couple of questions. First of all, I understand the tax issue. We're looking at not having any sort of tax, no GST, no HST. We'll treat this as a prescription drug rather than an over-the-counter drug, right? I'm assuming that's where we're going with this. So that's my first question, if you could respond to that. And the second question, I want your opinion on the conference that was held in Toronto at the end of the month, at the end of April, where physicians talked about they had the discussion on if marijuana should be, if it becomes legal for all, should doctors continue to prescribe it? And if they didn't do that, what would be some of the fallout of that? And there's a number of you that focus on, maybe I can get Anne to respond, and the Canadians for Fair Access and the Cannabis Canada to talk about the issues.
Who wants to start? Canadians for Fair Access?
Sure. So on the first question of prescription versus the over-the-counter, in Bill C-45, it proposes for the medical cannabis system as it stands today, as described by Cannabis Canada and Hydropothecary, to continue as is, largely moving into legalization. This will mean a distinct medical cannabis system from non-medical, where patients still have to go to their healthcare provider. They still have to go through that assessment to ensure that they are suitable for the use of medical cannabis and there's no risks in doing so. And then they get their products shipped directly to their homes. This is a distinct medical cannabis program that largely operates what I consider to be similar to an online pharmacy, where it's still a prescription-like document that's sent and used for medical purposes only, and that will be totally distinct. So this is what we're saying should be exempt from taxation. When it's used for medical purposes on the basis of a healthcare provider's authorization, it should be treated like every other medicine that is based on a doctor's authorization, and they are all exempt from tax. On the second question you had, this, I believe you're referencing the CCIC conference. I was a speaker there, so I attended this as well. CFAM has been advocating for a distinct medical cannabis system for the reasons we highlighted today. Patients have unique needs. It's, I think, irresponsible to suggest that patients, some of who have serious medical conditions like MS, like cancer, to go and simply self-medicate through a recreational cannabis store. That makes no sense. That's not a safe way for someone to integrate cannabis into their health plan, especially when they have other medications they're using. I would also note that over 11 or 12,000 Canadian physicians have currently authorized cannabis for medical purposes. The number keeps going up, so I just haven't seen the latest market data the past month. But this is a number that's growing month over month significantly. So I hear the CMA's concerns, but with that said, patients are very clear, the courts have been very clear, and every other or most other associations that represent different health authorities, such as nurses and pharmacists, have recommended a distinct medical cannabis system.
Okay, has anybody else got anything they want to add to that? Or Michael, you get time for one more question.
Mr. Chairman, I support the legalization of marijuana, mainly because I want to see it out of the hands of children. In the north, we are seeing too many children getting their hands on marijuana. It's out of control in some places. And now that I know that it'll decrease opioid use and it'll decrease alcohol use, I'm even more in support. But there was something mentioned today by Beer Canada, so I want to ask those of you that are focused on the cannabis that legalizing the marijuana will cut the prices by half. I didn't hear that before, and I'm just wondering if that's something that's, I would assume is.
As we scale up, that's a very ambitious target, and the United States is not an accurate comparator just because of our high regulation of production is a little different than the way they do it. We have added costs. That being said, as we scale up, there will be a reduction in price over time, but that won't, I mean, to be blunt, that won't be absorbed by the end consumer in many cases. What that will do is increase tax revenue to our provincial partners as they sell and distribute. There will ultimately be a rationalization of price just with any new industry, and at that point we can always look at the taxation system in the future to ensure that our government partners always receive fair revenue.
Okay, with that, we'll turn to, unless Beer Canada has anything they want to add to that discussion.